chairpersons for the session, Dr. Narayan Prasad sir and Dr. Sri Bhushan sir on the stage.
Thank you so much. It's an honor to be able to present here. And I've been given this very unique task of presenting to you this new initiative from the academics wing of the Mumbai Kidney Foundation, and as part of it, everyone here is gathered. So let me just quickly go through everything. Now I've put on some scenarios, but let me tell you, scenario 1, scenario 2, you can actually count how many scenarios could be there by the number of chairs that have been put up here. Each one of us has our own scenario. And I don't want to read through this, but just the basic idea is, suppose you are an early career nephrologist and you have worked in a center which has a good volume of a transplant. And now you're planning to go to your own city or your own area and want to develop yourself or show to the world, project yourself as a transplant nephrologist, and you don't have a good experience with ABO incompatible transplant. That can happen with someone, right? Next, go to another scenario wherein you have already started your practice and now you feel that in your area of practice, there is not a lot of pediatric nephrology that is happening, and you probably could maybe upgrade your skill and project yourself as someone as a pediatric nephrologist. Okay? Now, the scenarios could be very different. You take it from there. You think AV fistulas you want to create and want to project yourself as such. So how do you go about it? So this is where it comes up. The observership in nephrology, which is being now initiated and which will has already been in the process, and probably we are coming up in the new year, the 1st of Jan, and we will all keep you apprised. So basically, I don't need to tell you what an observership is, but it's a structured clinical rotation and with a predefined tenure and under a mentor or a very senior faculty who has carved a niche area for themselves. You practice in a safe learning environment, and now, of course, we are not talking about this during your 3 years of DNB training. You have already DNB or DM training. You are already a nephrologist. You know your substance. You're just skill upgrading yourself, right? It's different from shadowing, because in shadowing, you're just walking around seeing what the senior faculty is doing with probably not that much of a purpose, while here you will be directly interacting, seeing the cases, sitting in the OPDs. The pros of it, you're learning from someone very senior, you're getting an insight from all their experience. You have opportunity to imbibe their thinking process. How are they approaching a GN case? How are they treating a pediatric difficult case, a lupus case? How are they treating it? Opportunity to work in dedicated centers, as I'll come to later. You heard, I think the base was formed in the past session where you heard Dr. Narayan Prasad sir himself, Dr. Sri Bhushan Raju sir himself, the quantum of work. You choose a niche area, you go and work with them, you are bound to get an upgraded skill on what you already know. It's a step towards choosing a mentor. I think Vijay Kher sir also spoke about it. You find a like-minded one-to-one session, and probably this observership is the base from which you can build upon that mentorship, which will stay for life. What are the cons? There might not be direct interventions, but in nephrology you don't need. You need to pick up the brains. You need to pick up how the approach is. Hands-on experience is lacking, but that can be tuned to make sure that you have hands-on experience. Lack of standardized content, but when you're learning from the best who know their business, you will always get an exposure to that area and you can take it forward from there. Is it a time away from practice? As I'm sure the crux of the take-home message for all of you would be individualized, like we are going into precision medicine. We are trying to tell you that each and every one of you is different, and what the future lies ahead for you is something which you need to decide. So some key factors which come into this play, and I'll run through quickly, is the career plan, the trajectory you're looking at. It will help your networking, that's important. What are your future goals? The experience that you gain, the perspective that you gain that we spoke about, the value addition. You have to, when you're approaching this observership, don't just blindly go for an observership, see how much value it is actually adding to your practice. Location, travel, visa, which was applicable in the international, but we are talking about the national, and the cost of staying and probably self-funding yourself for that limited amount of period. Why do we need it? Because there is a subspecialization that's been an explosion. You have onco-nephrology, you have obstetrics nephrology, you have uronephrology, home-based dialysis, interventional nephrology. And so the few things that you can ask is, what is the area or locality where I'm deciding to settle? What is the area of need? Like I told you in this scenario, how skilled I am to that subspecialty. In those 3 years of my training that you all are going through, how much have I been exposed to that? Or is there something which I have not been exposed to? How can I project my skills different from my colleagues? There are 10 of them in my area. How do I project myself as being different? Is there a subspecialization which I really liked when I was working? And do I need to project myself as having that expertise over and above my colleagues? What is my financial liability? Can I afford to go for a subspecialization, so as to speak? And finally, it is up to you. Why bother with observership and spend extra time on it when I can grow my own practice? But as you must have heard, it is important. It's an important facet of your training. The way I look at it, we are at crossroads once we clear our DNB or DM exams. And interventional nephrology, peritoneal dialysis, transplantation, glomerular disorders, pediatric nephrology, interventional nephrology are the things that are important. So what's the current status? Dr. Nikhil has touched on it, everyone's touched on it. There are observerships available for the dialysis technicians and others. NUHS provides a handoff observership in few centers abroad, but it's not in nephrology. ISN, as Dr. Bhasin showed, there are some centers in AIMS which follow. And let's go to the next slide. Dr. Shyam Bansal sir sent an email, and I'm sure it will come up in the ISN con as well, where now you have a fellowship which has dedicated fellowship with certification. Transplantation 6 months, interventional nephrology 6 months, pediatric nephrology 6 months, 3 months of clinical nephrology, CAPD, and critical care. And this is the ISN website which Dr. Bhasin had shown. But now we come to what is over and beyond this, the observership program that the team is offering now, and why we all are here to understand better, is the first of its kind program. It's not a 3 months, 6 months sabbatical that you need to take. We have our mentors, our senior faculty here who have agreed to open the doors of their institutes and let you guys in. It's a golden opportunity. As I said, it can start from something as less as 1 month, and you and the faculty can decide as to how many months you want to do it. So this is doable, this is executable on paper. Renal transplantation, peritoneal dialysis, hemodialysis nuances and machines, pediatric nephrology is already in place now, as I'll show you in my subsequent slides. And we are coming up. You have seen the networking we are doing here. We know how passionate Dr. Umesh Khanna sir is, how passionate everyone here is about it. Everything else is going to follow. These are the baby steps which we are taking towards a dedicated observership program over the years. And look at the institutes which have agreed already. SGPGI Lucknow, Sir Gangaram, MPUH Nadiad, RN Tagore Hospital Kolkata, NIMS in Hyderabad, St. John's, Bangalore, KEM Pune, and Osmania in Hyderabad. So under the academic wing of the Mumbai Kidney Foundation, which has been, and sir showed all these, where the dialysis technicians, nurses, dietitians, nephrology residents are trained, we are now coming up with the observership program, and then beyond it, the mentorship program, where you can choose a mentor for a year, for 2 years, you can choose a mentor for life. And if during the observership you pick up a mentor and you like to be one-to-one-on-one, imagine the amount of, I wouldn't say the umbrella, but even the guidance into something other than nephrology, career, everything what we discussed here, so many soft skills, all these things will stay with you. We already have the mentors, and a lot of them are here. Vijay Khet sir is here. This is which I took from sir's slide. We are really not the stalwarts. We are just passionate as much as sir is. And the entire group, and a lot of you are here. Thank you. So what is it? You choose renal transplantation. You have these institutes. And SGPGI Lucknow is here. Sir is here. You can connect right now. Sir Gangaram is there. Nadiad, RN Tagore Hospital, Kolkata, Dr. D.S. Ray sir, ABO incompatible transplants. After your nephrology is over, you decide, before I go on to practice, I want to dedicate 1 month, stay in Kolkata, enjoy the food, enjoy the cuisine. Yes, it will be self-funded as of now. And what you get directly to work or observe Dr. D.S. Ray, or you get to work with Dr. Narayan Prasad or Sri Bhushan Raju sir. You go for PD. How much exposure do we have in PD? Maybe some of you are lucky enough. You choose to go there. There is a whole dedicated unit there, and who better to learn from the stalwarts? You can choose up to 1 month or to 3 months, depending on how much you want to know and understand the subject. Pediatric nephrology is at St. John's Hospital. We will be coming up with all of this with a brochure, and it will be circulated. And these are the names which I'm sure you know. If you don't know, some of them might turn up to be your examiners, so better know. Okay? And they are the who and who of nephrology in India. And it's a golden opportunity for you to not only network, but also to imbibe all their experience. And so the road ahead is very exciting. There are a bouquet of options which are available, and you are increasing options. You now have a fellowship where you can do it for dedicated 3 months, or you can start with an observership. You can call up maybe Manisha Sahai ma'am or Shri Bhushan Raju sir saying, sir, I just cannot give 6 months to this. I can probably come for 1.5 months, and I'm sure something will be worked out. I mean, how fortunate. I mean, I really think if this was, and I personally am thinking whether if I can convince my team there, if I could go for maybe 15 days or 1 month to get such kind of exposure. So it's not just for the ones who are in training. The earlier career nephrologists and others can go. And I leave you with this quote, and thank you. So I think we can chat over it, the questions. Yeah, from the chairpersons.
Yes, actually observership is one of the best things for the people who are actually not trained properly according to their own concepts.
Absolutely.
But few years back I was supposed to inspect one center, and where I was supposed to give a nod for continuation of the beginning of the transplantation program, and went there, and I found that the consultant there was actually not totally trained during the DM program in transplantation. So I denied giving it a permission. My opinion was actually very clear that unless they get trained properly in transplantation, I should not really give a permission for them to go ahead with the transplantation program, which will be something like their own first experiencing the transplantation on their own. Rather, they could have actually. And we have some program, the Aragyashri program, where I was supposed to give something long back, around 10-15 years back. So in that also I expressed that unless the transplantation program cannot be started in a center where the nephrologist should have actually trained in transplantation, at least there should be at least 20-25 per year. Centers should be doing 20-25 transplantations per year. Then the boy should have, or girl should have been trained there. Then only they should be given a permission to go ahead. And initially they accepted, but over a period of time, most of the centers are actually doing good number of transplantations and all. Similarly, every center has unique properties or something like that. In fact, our Institute of Nizam's Institute and Dr. Mohan Biyani's is actually sister renal centers to International Society of Nephrology. If at all I had to say sister renal center in this country as nephrology is concerned, I think SGPJ Lucknow and ours is the elder sister, and I'm the younger sister of the particular centers. And we almost try to replicate, but not in a true sense actually. We are slightly lagging behind SGPJ Lucknow. But similarly, it is a very good center, and we try to emulate them and try to copy them also a little bit in a good way. And these centers are not only our center, and most of the centers with the government institutions and even bigger centers like even Gangaram and these bigger hospitals, they are doing very well with certain aspects. Like, in fact, I tell my students also that if possible, try to go. Once upon a time, I used to tell them, go to AKDRC for transplantation. Absolutely. Like Gangaram also, the interventions and all other things. So most of the centers are doing very well. And as you correctly said, that some of the youngsters who want to learn a little bit more in detail about the particular aspect of it, probably they can choose these particular centers anywhere. So not only the one which are narrated, but other centers also.
Would want to also thank all of you all for agreeing to it. Now, this actually came up, MKF Academy's observership program came in because I think India has a fantastic technology called Jugaad. When you can't go to international society fellowships, when you can't get into Indian society because only one person can, what happens to the rest of the country if they want to learn a few things? It may not be the best program, it may not be the best standards of the world, but at least you get some exposure to places where these kind of activities are far and above the standard DNB programs in many places. Yes, we have now many people doing DNB, but then as mentioned by everybody, that all these centers do not have the standard which was required for whatever reasons, which we need not discuss now. But this offers them an opportunity to learn at least for a month or 1.5 months, some exposure, depending on how much time they have and they can contribute. both of you all have been very kind, and there are many other mentors sitting here who have been very kind to accept this kind of fellowship. Sanjay, from Narayan Prasad, we want to
We have already existing observership program, so anybody who wants to come, and every year we have some fellow coming from different institutions, Newer AIMS, Delhi, even from CMC fellow, they send some students on the rotations there to see how we are doing, how we are different. So every year 15 to 20 students comes for the 2 weeks or 4 weeks of the observership from Manipur, from every corners of India. People used to come from Kerala, we have the students. So that is already there, and definitely you just see how every work is being done in India also, and USA also, in Toronto also, and there something you learn in Toronto also.
Absolutely,
how
sir.
these people are approaching to the patient, how they are writing their prescriptions, what is the basis of evidence-based, non-evidence-based, so many things to learn. So thank you, Professor Umesh Khannaji,
Thank you.
for
I'll-
this excellent initiatives, and I would like to congratulate you, and I think this will be the one good initiative to take forward.
So any questions, we'll take